fine. This is Deliverance TV na karibu sana. You know, it is a very serious issue when you talk of medical issues. It has been disturbing everybody from youth to older people, and that's why today on Youth Care Unit we bring Dr. I think that had will be a bit tricky to name, so I give him a chance to introduce himself. My name is Sasam, and this is Youth Care Unit. Daktari.
Sam, don't be scared pronouncing my name.
I'm scared to pronounce their name. I think it's quite tricky.
Well, my name is Dr. Narinder Singh Thethy.
Narinder
Singh Thethy. And our clinic is very near ATG Deliverance Church.
Yes.
We are just next to ATG.
Yeah.
And the name of the clinic is the Brain Dynamics Clinic. And we have been practicing here. And today we will be talking about a very different type of medicine.
Yeah.
It's called homeopathic medicine.
Yeah.
So homeopathic medicine, I can just talk in a bit
maybe
brief.
you can tell us what homeopathic is.
Yeah.
Maybe.
It's a different system of medicine. Homeopathy is not conventional medicine, and it's not herbal medicine.
Yeah.
It's different branch of medicine. Like bachelor's degree in homeopathy, it's 5.5 years, which is almost equal to conventional medicine. And MD is further 3 years. It's very much scientific, and it's practiced in so many countries. And people like the medicine because it has got no side effects. And the medicines are very small in size. Medicines, they look like the size of mustard seed, comma fertilizer. You know, very, very small, tiny ones. So they are sweet as well. They are not bitter. And homeopathic medicines, they work on all different type of conditions. Hata kama ugonjwa ni ya zamani sana, still it can be treated and it can be cured as well with homeopathic medicine. And if you see somebody has been tired of taking medicines because they are not getting healed, I think for those people they should try homeopathy, and it works.
So it's like it's a better option compared to the rest.
I will not condemn other medicines because we complement each other.
Okay.
Because even conventional medicine, it has got its limits. Homeopathic medicine has got its limitations. There are some conditions, some medicines don't work, and then the other medical system can work on those conditions. So I don't want to say who is superior than which one is superior than the other one, but any medicine we have to work together with the conventional or herbal or homeopathy, whichever is working. End of the day, our mission is to help the suffering people so that they are not in pain, they are not suffering. So homeopathy is a very good system of medicine. It works and it helps. And you know, if I can talk about chronic ailments, sometimes people have been taking medicines for years and years, and they are told
This is
incurable.
Yeah.
Or you have to be on those medicines for the rest of his life. For those type of patients, I will advise that they should try homeopathy, and maybe they don't need medicine for the rest of their life. So they can be cured.
So Dr. Narinder, you're telling me if maybe you try homeopathic and you have these diseases, it means that you will not take them for the rest of your life. It's like you give them periods.
Yeah. Okay. Some conditions, you know, if you take medicines like a couple of weeks or couple of months, conditions, patients feel much better, and they don't need really, they don't have to take medicines for a long time, because homeopathy is not a habit-forming medicine, and it works to remove the root cause so that somebody is healed for good, and they are working, and we have been having our clinic since more than 15 years in Nairobi.
Nairobi.
Yeah, and we feel good when patients are feeling better. We feel satisfied as well that our work is really it helped somebody. So that's what we are trying to make.
So Dr. Narinder, how is the response? Of course, I know you have told us you have been having a clinic for 15 years.
Yeah.
So how has been the response? How has been your patients be responding? Do they like it?
Patients who come to our clinic, they have, people go to alternative medicines after trying so many hospitals.
Several, yeah.
And when they have been trying and they are not getting better, they want to try alternative medicines. So homeopathy, they come, and we have seen people, they come, they bring their family. Means when one patient is feeling better, obviously it goes to other people as well, the same message that these medicines, they work better. And people come, they improve, their condition improves. And even if somebody is having 10 problems, 20 problems, people have got very complicated problems sometimes. And when they are treated with homeopathy, all the problems, they start reducing one by one.
One by one.
And they feel better. And
so if I can ask Doctor, I know my viewer and I too would like to know how different is homeopathic maybe from the rest?
Homeopathy, how it is different. In there are different colleges in India and other countries as well. Definitely there are colleges and universities for a study homeopathy. And how it is different, number one, the way I said, okay, the medicines are very small in size, they are sweet. In conventional medicine and herbal medicine, as you know, some that if one tablet is not working, people, they take 2 tablets.
Yeah.
If 2 are not working, they take 3 tablets. Means they increase the medicinal substance to increase the power. But in homeopathy, it is completely different. Okay, even in herbal medicine, if 1 spoon of herbs is not working, you boil 2 spoons of that medicine, that herb. But in homeopathy, we reduce the medicinal substance and it becomes more powerful, like dynamization of the medicinal substance. We use, our medicines are also just like conventional medicinal substances. They are made from minerals, they are made from metals, they are made from herbs as well. So it's a completely different study, and the medicines are tested on human beings. Our homeopathy is not tested on rats or maybe animals. Our medicines directly tested on human beings, so we know exactly which medicine can work on which condition. It's completely different.
So if I can ask Dr. Narinder, which are some of the countries that maybe practice homeopathy?
Okay. Homeopathy, it started from Germany. From Germany, in India, it is really very advanced now. In India, even Ministry of Health, they employ homeopathic doctors. Ministry of Health has opened homeopathic dispensaries, homeopathic hospitals. Homeopathic dispensaries, people, they're in a district hospital, even government hospital, you will see there is a doctor of conventional medicine and there is doctor of homeopathic medicine. Government provides multiple options. for the people to choose whichever medicine is working on them. Government is providing these type of services in India.
That is in India.
In India, it is everywhere, even in Pakistan, even in Switzerland, even in Germany, even in Italy. You go to UK, I mean America, Canada, it's all over. Homeopathy, it's known. Okay, according to World Health Organization, homeopathy is the second most used medicine in the world
From
after conventional medicine. So conventional medicine is used a lot. After conventional medicine, it is homeopathy used by the people, and it's second most used medicine. So it's quite known in so many countries. Yeah.
So, Dr. Narinder, this is, I can say, is a youth show, and you know, one of the medical problems that has been of challenge to our young people is our mental problems. So, Doctor, I would like to know, when you practice homeopathic, how do you deal with mental problems, and maybe you can name some of them.
Yeah.
Yeah.
Okay, mental problems. These are medical conditions according to us. You know, there are people, they have got a lot of anxiety. Anxiety means somebody feels feels anxiety, his heart starts beating fast before an interview or before coming any type of work he want to start. Before that thing, he can start having anxiety. He becomes anxious, he becomes panic. So for these type of panic attacks, we have the medicines. After the treatment, people, their heart becomes normal. They don't start beating very fast when the way it used to be before homeopathic medicine. And also some people, you know, because of anxiety, they start sweating a lot. So when we treat them, their speech does not tremble, sweating is not there, and then they don't forget they wanted to talk. So anxiety, it's a very complicated problem. You know, if somebody who is very educated even, and if he is suffering from anxiety, if he is called for an interview, you will see he is not able to express what he can do, how good he is, how he can perform. So they fail. I mean, they can't succeed if there is anxiety. Also anxiety, you know, there are children at school, when in the class even, when they have anxiety, okay, even when teacher asks any question, they feel anxious, they cannot answer even the question of the teacher. So anxiety we treat from small age of children to elders to youth as well. So it is a medical condition for anxiety, panicness, panic attacks. And you know, there are some people, they sleep and they wake up around midnight because of the anxiety attack, and they panic. They have to do a lot of things to calm themselves. So those type of cases we have treated, and very successfully. Anxiety, we can finish anxiety with homeopathy. So that is anxiety. Another thing is like conditions like bipolar, schizophrenia. We have got very good medicines for bipolar and schizophrenia, and we have treated so many cases where extremes, people become angry, they become violent. With homeopathy, the anger, the violent condition, it cools down. And also another condition is suspicious behavior as well. You know, if husband wife, they have got suspicious behavior, even somebody talking to another person, your partner, your better half, who feels that you have got other relations with somebody. So even suspicious behavior is a medical condition, and we have treated so many cases whereby they were almost going to divorce because of their misunderstandings, and they are very much okay after the medical treatment. And we don't give counseling. We want to know how somebody is suffering, and then we give the medicine, and it works. And
I think that will lead me to a very sensitive question, doctor. And I will ask, you know, here in Kenya, we believe that those are just normal behaviors. And we believe that you can't cure behavior. You know, if I lack confidence, that we know is very normal. But according to you, you're telling me that it's treatable. So how do you deal with Kenyans and maybe try to fix them and show them that it is curable?
you know, we are all human beings.
Yeah.
Atakamani, somebody from Kenya, I'm a USA or India. We are all the same. I mean, just the same. And the people have same type of ailments everywhere because we are human beings. And confidence lacking also. We have treated so many cases. They have fear of failure. They will not succeed. They can't succeed. They have tried. So they believe they will stay like that as a failure. We have the medicine. And when you know what happens, when a patient comes to the clinic, to our clinic, we show them these are your medicines. They can read themselves. And then we select one medicine for his confidence, and they become okay. You know, there are some people, they cannot talk on a stage. When they go to a stage giving a speech, they start trembling because confidence is not there.
Not normal?
It's not normal, definitely. Because when you have confidence, you can deliver your message, you can give a talk. Yeah, and more boldly, not feeling shy or not having heart beating fast. So there is need of medicine for these type of treatment, and homeopathy can work on that very easily.
So doctor, when maybe you are treating like those behaviors, do you only give medicine? Is it like a dose, or do you maybe talk to these people? How is it done? Because
you know, according to us, we don't give any counseling to such people, such cases, because we are not, number one, we are not trained for that. We only know about the medical side of the human behavior, and even fears. You know, fears is a medical condition. People believe fears, people have got, it's natural having fear. But according to me, fears are medical conditions. You know, there are people, they are scared of even walking in the street. They feel fearful. They cannot cross a road. People have fear even from a high place. They cannot look down from a rooftop. So even fears are medical conditions, and we give medicine and it becomes okay. And when we say about somebody grown up, why somebody has fear? Because there is no medical test which can show what is the problem behind fears. You go to any lab, they will say this person has got normal brain. So according to us, let me give you an example. Have you seen sometime there is somebody who is watching TV? On a TV, if they see a snake coming, when they see a snake coming, they switch the channel to another station. I mean, they can't see a snake. There are some people, they are scared of cockroach even. There are some people, they are scared of cat. There are some people, they are scared of darkness. You will see somebody, if the light is not on the other room, they can't go. So there is fear of darkness. So according to us, somebody grown up who changes the channel of the TV just because there is a snake on the TV, that is a fear. And we have different medicine for snake fear. We have different medicine for cockroach fear. So it's all medical condition. So I don't think this person, he knows from TV, this snake will not come out to bite him. But still the fear is there, isn't
So you
it?
can't advise counseling maybe on that case?
Because he knows already it is a TV, it's just a picture.
Yeah.
So you can't, he does not need any that type of advice or counseling for on these type of conditions. I believe when we treat such cases, they stop having fears. Fears they finish. Yeah.
And maybe if we can talk of depression, you know, it's very normal, especially with young people.
Yes. You know, depression, conditions like bipolar, because lifestyle nowadays is very stressful.
Yeah.
You know, people have got financial problems, people have got unemployment is there, problems of ambitions, a lot of people, they have got very high ambitions. When they can't succeed, they go into depression.
Yeah.
They fail even in their maybe college or school. You know, small failure, we have seen people commit suicide as well.
Yeah.
So according to me, there are medicines for depression, there, and it can be treated. We have got many cases we have treated for depression and for schizophrenia, bipolar, very successfully. So even depression, it is treatable. You know, most of the people that come to us, they have gone to so many psychiatrists and psychologists for different services. But with the homeopathy, it's completely different. So I think we should work together with the other systems. And there is no reaction of homeopathic medicine with conventional medicine or any medicine. It can be taken along with the other system of medicine. So there is no reaction at all. So we are trying and we are happy.
So when you say they can maybe be taken together, maybe with these are
Conventional medicine.
These are the medicines. How should it be done? Because I think there must be a guideline. Maybe this is how you take this medicine and this is how you take this one.
Usually what happens, number one, patients who come to us, they have been trying those medicines. And after starting our medicine, when they feel the changes, they know which medicine to take and which to stop. Isn't it? Obviously. When you know another medicine somebody has been taking for 5 years, has been taking for 10 years, not working, and this medicine in 1 or 2, 3 months time, there is great improvement. People like...
so you check on the progress.
Oh, obviously. Even the patient himself, he can know that the medicine, the health has improved. Physically and mentally.
These are working and these are not working.
Yeah, he has to decide. It's obvious, because somebody who has been taking the medicines for a long time, and if he did not see the improvement, and after homeopathic treatment they see the improvement, that means he should know what to stop and what to continue. Yeah.
So you like leave it to the patients. You like don't like give them guidance or commands that you have to take these medicines, leave these ones alone. You give them freedom to choose.
All those patients, they are very wise people. They understand everything, and I think they themselves they feel good, and they continue with homeopathy.
Okay.
Yeah.
We'll pick it from there, doctor.
Yeah.
We take a short break. We're still with Dr. Narinder, who is a homeopathic doctor, and he's helping us discuss some of issues that are of great challenge to us. Don't go too far. We'll be right back.